Brown, please.
Thank you, Chair, and I want to acknowledge and thank Minister Harris for his comments in relation to the Education Committee's report in relation to mental health. I look forward to further engagement in relation to that, and obviously to welcome both ministers here. I have a few queries. Thanks, Michael. A few questions in particular that I would like to put to both of you. The comment was made earlier by one of my colleagues that the vision for change didn't work, but I would absolutely clearly say if it was implemented in the correct manner that it certainly would work. So I just want to clarify that. In 2017, 44 children were admitted into adult mental health services due to a bed shortage. And the current plan shows us that there are 69 CAMHS teams, but there's only 75 CAMHS beds. So 69 teams, 75 beds. What future plans are there to increase beds for children, given that that need is absolutely crucial? And if you could give us the number that are currently waiting for a CAMHS appointment. The introduction of the 20 psychologists and the 114 assistant psychologists that you have introduced to deal with the waiting list certainly is important, but I would like a little bit more information in relation to who will be training the assistant psychologists, what will their level of qualification be, and given the introduction of the vast number, how are we going to address the problem that there is in relation to the lack of spaces allocated to training clinical psychologists? I actually checked with UCG this morning, and there are only 10 in second year at this point, 16 in third year and 14 in first year. Now, I know that there are other universities that have training places, but there are similarly small places as well too. So if we're talking about bringing in 114, I just don't know where we're going to. Obviously we need to deal with the capacity level at a university place also. In relation to the whole telepsychiatry, and I do appreciate the clarification that has been given, but I just wonder what sort of engagement or consultation there has been with professionals in the field. And I know with the advances in telemedicine in relation to GP services, and I base that on a service that's existing in Ballymore Eustace in Kildare, which is certainly a very effective one, that a lot of medication and prescriptions can be given online. Is that what we're going to be looking at in terms of telepsychiatry too? Because I think it's a very, very different type of health intervention that's absolutely needed. I would contend that there is too much of a focus on medication and antidepressants as opposed to talk therapy. So I certainly think that in terms of looking at the cost and the expense of either one, that we should certainly be focusing on the whole talk therapy. And on that note, in relation to the 24-hour text line and the trained volunteers that are mentioned in dealing with that, who's going to be training the volunteers? Given the lengthy waiting times, are consultants going to have the time to train in volunteers, etc.? Are they going to be sourced by the HSE? Are they going to have a background in the whole mental health area?
You've thrown in a good few questions there.
And the last one, I do think that the Mental Health Commission should have powers similar to HICWA.
Okay. Deputy O'Loughlin, thank you I look forward to engaging with the Education Committee. I think you've been doing good work on this. I think we need to dovetail even more on it, and I'll give that commitment. I also appreciate what you said in relation to Vision for Change, because I think it's an important comment. We shouldn't confuse implementation with strategy or plans. I think the strategy, the vision, I think is something that we all accept was very good. It's actually about making sure we implement it. In relation to the issue of bed capacity, my colleague Minister Daly will comment on that, but there's already a number of developments underway in relation to trying to increase bed capacity. But we do crucially now have significant additional funding for more beds right across the spectrum of our health services, and I'll very shortly be asking our hospital groups and our community health organisations to identify how many beds do you need in your region across the various spectrum of healthcare. So again, rather than it being a top-down exercise where the HSE centrally says, there you go, we'll be asking people from a CHO area and from an acute hospitals area to identify the number of beds. On the issue of assistant psychologists, I've given a commitment to the committee to get more info on that, and we'll come back on that. I think this is an area I'd really appreciate your view on, because I think if it's an area that we believe has benefit, it's an area we could try and do more in relation to. My understanding from Minister Daly is that a lot of these are already people working within the system as opposed to people people taking up additional university places. Issue of telepsychiatry. I think we've obviously dealt with that, and the committee is going to do some more work on that. And on the Mental Health Commission, I must say I agree with you instinctively that we should look at increasing the powers of the Mental Health Commission, and I'm going to give that some further thought. You may have noticed in the Patient Safety Bill that I brought to Cabinet last week, of specifically not only is it now going to be enough to openly disclose, and Senator Devine and I discussed this in the Shannon last week, not only is it going to be enough to just openly disclose to the patient an issue, there's now an automatic, or will be when we pass the law, an automatic requirement to refer to the Mental Health Commission. So that the Mental Health Commission should have an ability to gather new data that's not gathered today in relation to not just how many incidents are openly disclosed to the patient, but it will enable them to see trends and information from right across our mental health service. We're doing similar for HICWA with our non-mental health services, so that will be a new function or ability given.
Minister, before I pass you on to Deputy Rabbit, just on the Mental Health Commission.
Yes, please.
Do you not think there is a conflict of interest there? They're being paid by the Department of Health, they're paid by the HSC, they report to the HSC about inadequacies in services. Does that not sort of make you wonder where the openness and the transparency is here? Also, agree with Deputy O'Loughlin, they're powerless. They absolutely have no power whatsoever. They criticise the services, and then that's the end of it, and it goes nowhere. So I really, really think you should. I'd like an answer about the conflict of interest there, and then I'm going to pass you on to Deputy Rabbit.
Sure. On the conflict of interest, I don't believe there is one, and I'll tell you why. Because we already fund nearly all of the agencies that have a responsibility. So if I was to take that logic and apply it, say, to HICWA, HICWA is obviously an agency that's funded through my department, and HICWA is an agency that is regularly and rightly and appropriately in doing its job highly critical of aspects of our health service. Similarly with Ombudsman. So I take the point you make, but I suppose I'd probably come in for greater criticism if the state wasn't funding the Mental Health Commission. I'm confident that it is robust and independent in the discharge of its functions. I am open to a conversation about its powers, and would welcome any views or guidance in relation to that from this committee.
I do think